literally just me trucking around by myself all day.
How many horses did you bring?
Just 4.
4 from Canada.
Yeah.
Okay. I keep getting this pop-up every time I go live, but then it says that I'm actually live. I had this thing last time too. So let me make sure I can see us in the group page. And I'll make sure to drop links afterwards.
Sure.
So people can reach out to you. Hold on, give me a minute. This takes a second. Well, since Facebook changed their integration on
Nightmare.
yeah, that Zoom to Facebook integration, it gets a little trickier.
Yeah, and we do have a special discount code for you guys too that we can talk about at the end or something. I'm just gonna make sure I pull it up so I don't get it wrong when I talk about it.
That's so awesome. How cool is that? Yeah, I have been wanting to talk to you for a while because my Facebook, Instagram feed and TikTok, I
It's
think,
full
is
of videos of
totally,
our cryotherapy.
yeah.
Yeah.
So I'm like, oh my gosh, I have to talk to somebody about this.
Well,
So
I've been told I talk a lot, so I think we got this.
right on. Excellent. I'm excited. So you guys, happy Monday, January 13th. 2025. Today we have Justin Prathers. He is an FEI athlete. You guys can see he's an active competitor. He is literally in thermal or near thermal California, and he will spend his whole winter competing down there. He's a trainer and also focuses on whole body health for equine. And he represents American Cryo, which has cryotherapy equipment, but also other therapeutic rehabilitation equipment. And so welcome today to the Holistic Animal Insights page.
Yeah, thanks so much for having me, Poppy.
It's our pleasure. So like I was saying, I was bombarded by America Cryo ads and I wanted to know more because I think it's such a cool, literally cool
Yeah, yeah.
idea.
Pun intended.
Pun intended. And so tell us, what is cryo?
So cryotherapy as a category, I mean, on the surface, it seems like kind of fancy icing, but really what you're trying to do, and the reason that we use these, super cold, like liquid gases, is you're trying to create a thermal shock in the tissues that you're treating. So when you're, in our case, we're using liquid CO2. And when you apply that through our Sub-Zero device to the skin, you get a rapid drop in temperature from, and I'm Canadian, so I'm going to talk in Celsius. I'm really sorry for all the Americans. But you go from, normal body temperature of like 36 degrees down to, around 2 or 3 degrees Celsius in a matter of seconds. And you can sustain that pretty readily over the treatment area with no issues. And the effect that has on the body is it's called a thermal shock. So there's kind of 2 main pathways that affects, and one is vascular. So during treatment, similar to like if you got something cold, just conventionally, you're going to get a vasoconstriction. All those blood vessels are going to clamp down and send blood out of that area and deeper into the core, where it gets more oxygen rich and more nutrient rich. Then like 90 seconds or so post-treatment, you get a major vasodilation, and especially a dilation in the capillaries that gives sort of that final delivery of blood to the tissues. And so you're bringing back a higher volume of blood that is more oxygen and nutrient rich to let those tissues do their job more effectively. And then there's a similar neurologic effect that, there's kind of a negotiation between the body part and the brain that says, hey, something's going on. We're not really sure what's going on, but it's not unsafe. It's not an issue. So we're just going to kind of like turn down our sensitivity a little bit, and you get a massive analgesic effect out of it. So, for chronic pain management, inflammation control, like sore muscles, soft tissue injuries, you get a huge boost in both how the horses feel, so they're more comfortable and can, either recover better or do their job better, but also a much, because you're delivering that better blood to those tissues, they can recover faster on their own without sort of, I'm going to say, conventional medical intervention.
Justin, I know ice baths have like hit the holistic scene like it's all the rage, right? Is it something similar to that?
Yeah, so probably the closest analog would be like a cold plunge. That's obviously more of a whole body thing, but it's the same effect where you're dropping the temperature so rapidly that you're invoking that thermal shock in the tissues. But anecdotally, like this is much more comfortable than jumping in a tub of ice.
How long have you been in the horse industry? Like, did you grow up in the horse industry?
Yeah, so my parents were worried that I was going to want to play hockey and they had no interest. And so they bought a pony. And then, 25 years later, here we are where, we've built a barn and we've owned a ton of horses and done our best to kind of compete up the ranks. And I don't know if that was the intent at the time, but it's where we ended up.
Amazing. And what got you into the holistic aspect?
Originally, so my dad is always sort of curious about new things and trying stuff, and so that's how over time, we had a Centurion blanket back in the day, and then we ended up like 15 years ago with our first class 4 laser, and then an Equivibe or like a TheraPlate type deal, and the more that we got into horses, par for the course is you have horses that get injured, and we're very kind of like to do things ourselves. And so the more that we had to deal with our horses getting injured over time, the more we learned about how to take care of them, the more we got involved in the tools, ultimately led to like now I have a rehab room at my farm with a water treadmill and a salt spa, and that also kind of led me down this path of becoming part of America Cryo and doing it more on the seller side as opposed to the receiver side and just the treatment side of things, which has been really cool.
So you're Canadian. I have to say it out loud, even though you represent America Cryo, which I think is so weird. And so your home, your barn at home is literally in Canada.
Yeah, like 30 minutes from Spruce Meadows in Calgary.
Oh, I can't imagine how beautiful that is.
Yeah, it's great in the summer. It's a little chilly in the winter.
I'm okay. I'll stay in California.
Yeah. Yeah.
That's why you come to California in the winter.
Exactly. It's really depressing riding in circles indoors all winter. So we come down here.
That's awesome. So my dog is barking at his ball that's stuck under a bed. So I'm going to say, I'll throw a question at you.
Sure.
And you can just chat about it. Is cryo safe and effective for all horses?
Yeah. So, I mean, with anything you're doing with horses, there's always going to be exceptions to, what they'll tolerate. But generally speaking, it's really easy to get the horses comfortable with the treatments and, accepting of what you're doing to them. After 2 or 3 sessions, most of them, see you coming with the device and look for you to do it. They really like it. And the nice thing about cryotherapy, compared to some other modalities is you can't do harm by doing it at a time when it's not needed. Like there's other modalities where if you do it at a time when it's maybe not needed or could be contraindicated due to an injury or something like that, you can exacerbate a problem. But that's not really the case with cryotherapy, which is nice. And with our device in particular too, we have built-in safety mechanisms that really help mitigate that risk and prevent you from doing harm. And also one of our big values that we push on is if we're going to sell you a product and we're going to give you these devices to work on horses, like horses can't advocate for themselves. So we make sure that you're as prepared as possible to do the treatment safely. Everything comes with training. You go through a certification process. You also always have access to reach out to me or another member of the team to ask questions, or, there's always going to be situations that come up that are maybe a little bit not in the handbook, so to speak. And we're here to help with that, because at the end of the day, this is all about the welfare of the animals, and they can't advocate for themselves. So we make sure that they're protected. I think you're muted.
I am. Thank you. All right. So it's safe for pregnancy. It's safe at horse shows. You can use it literally like before you go in the show arena.
Yeah, there are some considerations around that. So, and this is kind of a blanket statement with, I think, any of these, I'm going to say, more effective therapies, whether you're talking about the cryotherapy or the lasers or the PEMF or whatnot, because you can make something feel better doesn't mean it is better.
Thank you.
So it's always a consideration that if you're doing stuff with your own horses, it's your risk, and you understand those animals, and you can operate with that knowledge. But in general, it's best to do these kinds of treatments after work as opposed to before work, because like if we went to a football player and did a treatment and they went back out on the field, you can tell them, you got to be extra conscientious about what's going on in your body because we've made it feel better doesn't mean it is better. You can't have that conversation with a horse. So it's best to either push your treatments farther out on the front end of work, like say 4 to 6 hours, or to do it after work. Once you've gone overnight or whatever, it's not much of a consideration anymore. But you don't want to cause a secondary repercussion because you've made something feel so good that the horses do something where they otherwise would have protected themselves a little bit.
So does it numb? Is that why there might be an issue pre-show, too close to performing?
Yeah, I think, I guess as a basic term, yeah, it is a little bit numbing, but I think it's more akin to like if you take an aspirin, you haven't numbed your pain, you've mitigated the amount that you're feeling it. And I think that it's a subtle distinction, but it is a distinction. The other thing too is you can because you can cause like a relaxing effect on those tissues sometimes, and this is more something I've been conscientious with the lasers as opposed to the Sub-Zero. But like with a laser, you can warm up a tissue to the point that it's almost kind of too soft um, to go straight into work. And then you have to think a little bit about the amount of strain you're putting on that warm tissue. You're supposed to stretch and warm up and stuff before work, but there's a degree to which I think that becomes a little bit too far. And so you always just want to be conscientious about what are the repercussions of what you're making feeling better and how to manage that in the work.
What wouldn't you use cryo on?
The only the only thing that you have to be a little bit careful about is like broken skin. And the nice thing is if you treat something that it's not going to help, it's just not going to help it. It's not going to cause problems. But in the case where you have like a laceration or an abrasion or something on the surface where the skin is damaged, because that's the barrier to foreign bodies entering foreign you know what I'm trying to say, entering the body. You just don't want to sort of blow right on that because you can introduce a foreign contaminant into the skin. But the way to mitigate that is just with like a piece of cellophane wrap to create that sort of artificial barrier where in most cases the skin would be that barrier. And then really the only big one is like you don't want to treat something that's actively bleeding, and that's kind of across the board with all these things because they are increasing circulation. You can increase the degree to which something is actively bleeding, and so that's just a little bit of a point of consideration for that.
So Justin, let's say a horse hurts themselves. Is there like a point of time that you don't do it, like initial insult? Do you wait, or is an acute initial insult a really good time to be doing that?
No, especially with the cryotherapy, you really can benefit the timeline of that recovery if you can get it in the acute phase. And an example that I lived, I had a friend who had it was an older horse. It had a previous injury, and it went in the Grand Prix. It jumped the first round, jumped the jump off, won, but came out on 3 legs, and it had damaged a tendon. And I was there when we scanned it right after the class, and it really was barely holding on by a thread. And because we were there, we started treating it like the next morning, quite aggressively, like kind of 3 times a day. And then the horse came back to my farm, and we kept on that schedule. And 10 days later, when they rescanned the leg because they were trying to get it prepped to move back to the owner, we were already starting to see fibers reforming in what had been just a void space in the leg, which on that kind of timeline for the degree of injury is quite wild. And you could even see on the outside of the leg, it was wrapped most of the time when we weren't treating it, but you could see like just the degree to which that inflammation had gone down and the leg was looking less atypical, and the horse just being more comfortable and being able to lay down and sleep and stuff after only a little more than a week is pretty unreal.
That's really exciting. That's a great case study. That's absolutely amazing. Now, did you also involve your laser with that rehab?
Not in that case, and the horse is getting lasered now, but sometimes when you have an acute injury like that, and especially to that degree, you don't really want to soften up those tissues with the laser. Like because the laser can be so effective at breaking down scar tissue, at that point in the process, you almost want that scarification happening to help stabilize the injury. And you can deal with breaking down the scarification later. But to me, the laser is a tool that you go to, not way down the road from something like that, but that you need to give a little bit of consideration to the timeline. And same thing, like you wouldn't have shockwaved that injury because it was just too fresh and acute. And those, to me, they work on different philosophies, but they're both sort of stimulative therapies in my mind. And I think you don't really always want to stimulate a fresh acute injury, whereas you don't need to worry about that with the cryotherapy, which just gives you that tool to get started that much faster.
Yeah. So you also do laser. America Cryo has a bunch of different modalities.
Yeah.
And so I love that you have like this whole holistic menu of rehab stuff. It's very cool. Now, with the cryo, you're freezing, you're cooling, and the tendons are coming together. I actually have had the opportunity to do some dissections, and those tendons are crazy thick. And these big jumpers are jumping huge. They're landing on tiny legs, and for them to the tendons are literally like rubber bands. And so for that to just be kind of damaged and almost torn completely, it sounds like, is terrible.
It was quite wild. And you think too, like, most of the time, conventional wisdom is you like throw ice boots on for 20 minutes or you cold hose for half your life or whatever. And then you're wrapping and you're poulticing and all those things. And for me, at least, like I've found since I've been sort of replacing that aftercare routine with the Sub-Zero, I'm bandaging less and I'm going to less topical things on the legs because the legs just look better.
Yeah, and I've always wondered about those topical stuff, like the absorbing or whatever you guys like to use. Is it actually safe? Like, is it a toxin eventually?
Yeah.
So how long can you do those things and reach a max level where you're actually doing some kidney or liver damage?
Well, and it's interesting too because like take DMSO for example, is something that back in the day nobody thought about. Now it's you wear gloves and you're careful because I think it's a bit carcinogenic.
It's
but we
solvent.
Still use it on the horses.
Yeah.
But the thing is, we don't think about the repercussions for the person doing those things, right? So like now we think about it with something like DMSO, but like you're saying, with all those other topicals that we're also being exposed to, we don't think about it for the horses because typically their lifespans aren't long enough that you have to consider something like cancer. But for us, it really is. And so we're being exposed to it just as much as they are, if not more, because we're doing multiple horses. And that, I think, is something that doesn't come up very often.
Yeah, it's terrifying to me. I actually do charcoal baths on my horses because I feel like how much fly spray can accumulate on their dermal skin.
Yeah.
Like they're just absorbing all this toxin all the time. And I'm like,
well, and exactly to this point, I actually had a friend who misread or didn't read the directions on some serious fly spray and damaged her liver because
She damaged her liver
her own liver. Yeah,
because she was spraying it and wiping it, or
it was supposed to be a wipe on, and she had been spraying it and was doing that all winter in Florida, and ended up like they thought they couldn't figure out what was wrong with her liver and was having serious problems until they eventually tracked down this that she'd been using this fly spray. So it really can be a consideration.
a lot of horses have liver damage too. And I wonder if this is the cause. Thank you for sharing that with me. Wow. My mind is kind of blown right now.
Yeah, I mean, it's just weird how much these things can kind of cascade if you don't look at the bigger picture.
Right, because it's bucket theory. You're just insult after insult after insult. And a lot of people think essential oils are safe, so they're pouring that on. And then you're just making this like chemical soup on your horse's body, which I think is terrifying. So maybe another benefit to cryo is it's drug free and it's like toxin free.
Yeah, and I think across the board with all of these like external modalities, you're not having those I'm going to say contamination is not quite the right word, but those considerations like you do when you're doing the topicals or when you're doing medications or whatever, because in the case of the cryo, it's carbon dioxide, it's in the air all around us. In the case of a laser, it's just light. In the case of a PEMF, it's just magnetic fields. It's much less invasive, even though we don't think about sometimes those topical things being an invasive item.
Yeah. Can you harm yourself with cryo, like breathing in the carbon dioxide, or is that a like totally you're in a ventilated area, so you're not so
Yeah, it's more of a consideration when you're on the people side of things, like working in a clinic. You do have to think about not kind of stuffing yourself in the broom closet to do treatments. You need a little bit of airflow, but typically when you're working on horses, because you're either in a huge indoor space or an outdoor space, it's not much of a concern. And the even though the CO2 is you can't sort of see it or taste it or smell it, but there's clear signs if you are getting a bit of a collection of it where you're working. You're gonna notice that you're a little bit dizzy or things like that. Like there's indicators before it becomes unsafe that there's an issue. But also the probability of that happening in our working environment is practically zero.
what's the time frame of a session?
So most of the time, because we're a localized machine, so you're typically thinking in terms of spot treatments. Like a tendon would be a spot treatment, a knee would be a spot treatment, those kinds of things, and they each take about 60 seconds. So it's really efficient in terms of treatment time.
That's amazing. So yeah, you're not going to get a lot of CO2 like
No.
doing 60 seconds. What about kissing spine?
Yeah, and that kind of delves into like a structural problem, right? So it's something that you're not necessarily going to reverse that structural problem. But for me, a lot of the time, the way to mitigate the effects of that is in strength training. So when you use something like the Sub-Zero, you can relax the muscles around the area and decrease the pain in the area, which means that you can work the horses more properly to get them stronger, to then over time make the cumulative effect of that issue lower because it's better supported.
Yeah, and I'm also thinking about like maybe PSSM or some of these muscle disorders in these horses. Would that be beneficial?
I think when you start getting down into those sorts of topics, the best thing to do is to work with your vet on it. And that's not to say that it is or it isn't safe, but because those conditions can be so individualized into how they present and the factors involved, yes, but I think that's when it's time to involve a little bit of oversight on those treatments. Just because again, like the horses can't advocate for themselves, so it's best to take that little bit more conservative, cautious approach in doing it a little bit under that sort of supervision.
And when you like, let's say I'm at thermal and I want a treatment, what does a treatment cost?
It varies a lot, and it depends too. Some people incorporate it as part of like a body work plan, and so they're going to have their flat fee for a session, and they're going to pull out the tools that they feel are most appropriate for what they're feeling in the horse. What I like to do and what I always sort of advise people when they ask me this question is you can base your pricing around what a saltwater session would cost, because that varies a lot between disciplines and between locations, and it's a good barometer. So let's say, for example, here in thermal, you're going to pay like $125 to go in the salt spa. So that to me means that a session doing tendons on the horses, like all four tendons, is going to be somewhere in like the $80 range to do those four legs. And it scales with the way you want to run your business and how we're getting excited back there and how much you want to either smaller chunks of billing or whole numbers, but it's going to be in line with what you're going to pay for a massage or for physio or for a salt spa or whatever, because those kind of become the industry benchmarks for what these services are worth.
And can you use it prophylactically? Like, would you just do it as part of a wellness package, preventative?
Yeah, you totally can. For me, I'm more of a kind of do as the horses tell me kind of person. So I'm looking for indicators in the horses as to what might be an issue for them right now, how they're feeling, how things look, how things palpate. But you absolutely can do it prophylactically ahead of time, to help mitigate those things coming up in the first place.
Right. Very cool. Very interesting. Now, laser, talk to me about your laser. I don't think it's totally different than red light, correct?
Yes and no. So the differences are going to be that, like red light and laser can work on the same wavelengths of light, but laser light is cohesive and single wavelength. So I mean, if we really want to get into the weeds, laser is all polarized the same way, is one wavelength, and is a cohesive production of light. Where red light therapy, if you're dealing with like LED diodes producing red light, that's not necessarily cohesive and polar and just that one specific wavelength. So the effects of laser are typically more pronounced than just red light therapy, but also that's a bit of a blanket statement. It's depends on the device.
So in plain English, penetration's deeper. Is that what you're saying?
Yeah, so yeah, sorry, I went off the deep end a little there.
No, it's totally okay. I was following you. I just wanted to make it a little more simple.
Yeah, I think laser is going to be effectively like more bang for your buck. For every bit of energy you put in, you're getting more value out of, because it's all going to be exactly what you're trying to get out of that laser light.
Now, is this medical laser like medical? Like my veterinarian does laser for everything. She is like so into laser, but it's like she does surgery with her laser.
Yeah.
And it's not that.
Actually, our newest class 4 laser does actually have surgical protocols and surgical instruments that you can get for it. Obviously, you and me aren't going to be doing that.
Right.
But the thing that what really can differentiate between like, is this something we're using like for cautery in a surgery versus is this something we're using therapeutically, is what area are we delivering this energy over? Because the smaller the area that you're sort of focusing that light into, the higher the intensity the tissues are experiencing. So when we're doing it as treatments, it's a much more diffuse beam over a larger area, whereas when they're doing it surgically, it's very narrow, targeted, like pinpoint, so that they can kind of create the maximum heating in the smallest area to do something like cauterize a bleed.
And so cauterizing, you're literally burning the skin in a way.
Yeah, and that's kind of getting out of the realm of what I do and what I know how to do, but that on a theory basis, that's kind of the idea. Is yeah, you're burning the tissues a little bit to stop a bleed.
Yeah. And thank you for showing me that. Do you have your cryo machine there too?
Yeah.
I want to see that. I've never seen one. Your laser looks very similar to what my vet uses.
Yeah, and this one's nice too. It's for how powerful it is as a class 4 laser, like it's 27 watts over 4 wavelengths, which is um, up there in terms of what is realistic for like the average person to use. It's so small, like,
That's
you know, it's
crazy.
like a toaster, which is great because it means that it's so much easier to use, to, you know, have to truck around or carry to a horse or whatever. Or even if you're, you know, you're kind of off on the edge of the aisle and you got to hold it in your hand, to get the most reach to get to a horse, like you have it, it's easy. And especially
Can
compared to
you
like,
toast your toast with it?
you know, I haven't tried, but it maybe is worth it for science.
I would be. Let me know how it goes. You're like at the horse show doing your bread.
Yeah. You know, I think though it might take you longer than it's worth, but you might get it done in the end. And then the Sub-Zero, so that's the whole Sub-Zero.
That's it?
You know, not including the tank, which is in a corner back there.
Okay,
But
and how big's the tank? Like, is that like an oxygen tank size?
yeah, would be similar. So I like to suffer, so I get bigger tanks because I find it's easier to not have to go back for them as often. Typically, most people are going to do a 20-pound tank, which is think like scuba tank sized. And that's going to be good for doing, say, like 18-ish spot treatments.
Oh, that's
Um,
bad.
and then, you know, I like the 50-pound tanks, which most people don't because they weigh like 200 pounds when they're full. Um, but it all depends on your use case and stuff. And the nice thing is any like 7-Eleven or restaurant or McDonald's that has a drink fountain needs CO2, which means that if you're traveling somewhere, you can source the tank locally and just bring this with you.
That's amazing. So you don't have to drag a huge tank with you. You can just stick it on a dolly and drag it around.
Yeah.
And and you just buy it at an air supply store or
Yeah, typically welding suppliers is where we go. And the nice thing is, like, you know, even I have an account with the place at home, but it's a big national chain, and I use the same account down here, so I
oh,
don't have to
cool.
set anything else up. And you can rent the tanks, so you get charged like by the day to take them. So if you're at a place for 2 weeks, you pick one up, you use it, you drop it back off when you're done, and they bill you for the time, and away you go. Like it's very easy.
I love that you guys train people. How much is that machine?
The Sub-Zero, so this one is $7,500, $7,499, which is, you know, especially in the category of these medical devices, sort of across the board, everything we offer is quite reasonably priced relative to other things you can find on the market.
And can you do it? You were doing the jumper 3 times a day, actually, right?
Yeah, that one that had the injury, yeah, kind of on a bit of a 4-hour rotation. So like 8 a.m., noon, and 4 p.m. And that's by no means is that what you're going to do in every case, but this was such an aggressive acute injury that we really wanted to try and give it the best possibility of a good outcome.
So you can do back to back in a fairly close time frame, maybe. And you did that for 2 weeks, back to back.
Yeah, roughly 10 days, yeah.
And can you over freeze? Like, how would you know if you're overdoing it?
So the worst case scenario with that is that you could cause like a frostbite effectively. But that being said, the under sort of normal operating conditions, that's very difficult. And if you look, I don't know how well you can see, but in the end here,
Hold
so
on.
that's the nozzle where like the CO2 is dispensed, and then there's a distance and a temperature sensor on either side that measure how close you are to the skin and what the temperature of the skin is. And if it detects an unsafe situation, it just shuts off the gas supply. Where you could get in trouble is if there's moisture on the skin. So if like the hair is wet or there's a topical or something like that, because that can affect the rate of cooling. That's really when you can get into trouble. But that's why we have training.
Yeah, that makes sense. I mean, it's legitimate medical equipment. And how close do you get? I would assume that you would adjust that for the need.
You're kind of roughly 6 inches, so about that far away most of the time. Um, the
I don't think that's 6 inches.
Well, I'm a man. I am not good at estimating.
I was like, whoa,
I swear it's the camera. It adds 10 pounds.
it's a foot.
But yeah, you're going to be roughly like in that 6 inch ish range, and it does depend too a little bit, how thick a coat the horses have and things like that. Sometimes you need to get a little bit closer or a little bit farther away if one is especially sensitive or something. But that's kind of the target, is roughly 6 inches.
If people are interested in getting training purchase or even just seeing you or somebody use it, how would they go about doing that?
Uh, the best thing to do if you want to see what it's like is check out our socials. So like on Instagram and Facebook and TikTok, we're always trying to push out both just interesting content with it, as well as educational content. And for more details, the best place to go is to our website, americacryoequine.com. And there you can get more information, and you can also schedule a time to talk with one of us for more information.
Hey, Justin, what about foundering laminitic horses?
So obviously it depends on the degree to which that has digressed or uh,
The evolution
gotten
of
worse.
it.
Yeah.
Yeah.
So you can help it because both you can help make it less painful, and you can help get those horses moving a little bit. You can increase the blood flow into the foot, and really help deal with it that way. The thing that you sort of, once it gets to the point that you have like a proper rotational founder, then there's not a whole lot you can do in general. But in those preceding less severe steps, you can definitely help out, because you can really get that blood flow moving through the foot more effectively, which is the best thing you're going to do to help take care of that.
Absolutely. It sounds like it would be really a great tool for that. I was just curious also, is how much does the hoof actually respond to cryo?
It's super interesting, because typically if you have one that gets footsore, or you need to ice a foot or whatever, you're going to stand them in ice water, which means one of two things is going to happen. Either their feet are going to get wet, which has its own repercussions if you have to do it enough times, or you're going to risk your life trying to wrap a plastic bag around the foot. So the cool thing with this is, because you can't cause a frostbite or an issue on the hoof horn, you can push the hoof wall really cold to help suck heat out of the interior of the foot. And also at the same time, it's totally dry. So you don't get any of the cascading repercussions of the feet getting soft, or a quarter crack, or thrush, or whatnot that can come up when the feet are wet all the time. The other thing too that's interesting is, if you have thrush or scratches or some of those like bacterial things going on, and this, it's going to be most common down by the feet, but can happen anywhere. You have a detrimental effect on those bacterial colonies with these treatments, both because of the temperature and because it's anoxic during treatment. So, say there's a population of 1 million bacteria, you're not going to wipe that out in one pass, but you can cut that down and slow the reproduction rate enough that the body can take over and clear it much more effectively.
It's really neat. I love that. So you could just, on a consistent level, eradicate bacteria just by freezing it.
Yeah, and obviously the time that you're going to see that is if you have like an active infection, but it will be harmful to any sort of lingering surface bacteria in a treatment area.
I would imagine it would also be pretty aggressive towards any like topical parasites. So
Yeah,
if
for
you had
sure.
like a skin parasite, you could probably freeze the crud out of that.
Yeah, and again, I think you're getting into territory where the best thing to do is to consult a vet. When you have something like that, because for every horse, there's 5 million different possible things that could cause an infection or an issue, and they're not all going to respond the same. But definitely, it's a tool that can be used in those cases.
And somebody's asking, Sherry's asking, what about sarcoids?
Sarcoids are tricky. So I've always been taught that sarcoids are something that if you don't need to mess with them, you don't mess with them. Because if you make them angry, you'll regret it. That being said, um, you can if you can properly freeze a sarcoid on the right schedule, which I don't know off the top of my head, but you can clear them. You have to be a little bit careful though, where they are and how you treat them, because again, like if you make the wrong one angry, you can have a problem. But you definitely can on sarcoids get them resolved. But I know that there is a bit of a strict sort of regiment to when and how you treat them to get those results out of it.
So I actually did cryosurgery on my horse's squamous cell carcinoma on his eyelid,
Mm-hmm.
or like the third eyelid. It was like right in there, and it cured it. It
Oh
totally cured.
wow.
Yeah, I had to do 2 treatments. It looked like hamburger. It looked really
Yeah, I bet.
messy for a couple days. I was like, you guys didn't really tell me about this part. And they're like, oh, it'll be fine. Don't worry about it. And by golly, it was done. Oh my gosh, probably 7 years ago. And he's been great.
Wow, that's amazing.
Yeah. So I'm a fan. I'm totally a fan. And I have a video of it and stuff. I show
Yeah,
it
yeah,
to everybody, but
cool.
I love this idea of cryo, and because I kept getting plummeted in my feed with your ads, I was like, I have to talk to you guys about this because of my horse, the squamous cell. It under vet supervision, the sarcoid treatment might be really productive. And
Yeah,
then if you
definitely.
have some like weird topical skin parasite, that might be kind of fun to play with.
Well, and again, because you're not being invasive with it, it can it can be a better uh, it can be a better outcome for some of those things because you're not having to give aggressive medications. You're not having to go to a surgical option, which, those things are effective, but also they have their own repercussions. So to me, like the more that you can avoid, even on a much more basic level, like if you can avoid a joint injection because you can care for things other ways, that helps the long-term longevity more to me, and that's a huge benefit of some of these modalities.
That's a big win because sticking a needle in a joint, you always risk infection. So can have you noticed that you could push off your joint injections like a year longer or 6 months longer?
Yeah, yes and no. I mean, my horses work super hard. So I think
Right.
to me, I'm not looking on 12-month timelines, but if I can get from 6 to 8 months or 8 to 12 months, then that to me is a huge win because both in terms of, my bank account and having to spend all that money with the vet, but also like I'm a believer that the more times you invade a joint, the more times you're going to have to invade a joint. So if you can, any amount that you can push those off is helpful in the long term.
And what about dogs?
Yeah. So because with any of these things, land dwelling mammals, for the most part, all sort of biologically operate the same way, which means that, short of some accommodations for body size and hair and, skin density and stuff, the theory applies across the board.
So for dogs, if they hurt themselves, CCL tears, stuff like that could be really productive.
Yeah, and the other thing too is with dogs, I love the class 4 laser, but because dogs are so much smaller, and laser is all about delivering a certain amount of energy to a given area. The area on dogs is a lot smaller, which means that you can step down to something like a 3B laser on a dog and oftentimes have just as good of a result, given a little bit of time input because you're not trying to cover the same area as if like the back of a horse is a giant amount of area to cover, right? And same with the cryotherapy, you can really alleviate a lot of the the pain and the sources of some of those issues, and still help with the soft tissue recovery, the same as like a tendon injury on a horse.
So when you use your laser, when you make your choice, your rehab choice, do you have like this whole protocol where you're like, okay, cryo, 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 now laser, 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 and shockwave whenever?
Yeah, and I have a really good team around me. I have a really good groom, and I have I have resources even just inside of the people in America Cryo. If I'm ever not sure about what to go to, there's always people to ask. And to me, it really comes down to one, mileage and seeing the effects on different things, but two, like involving that team to help figure out what the best option is. And there's going to be overlap between the things you can do with all the machines, but the more time you spend with them, the more you find particular use cases where one sort of outshines the rest. Like, for example, to me, if I have like a horse got a cut or like something, a bad laceration that really scarified, and it's old, and that tissue gets kind of crunchy and problematic, you can really break that up with a laser. Whereas if you have like a cellulitis or something like that, that's a use case where you're going to jump to the Sub-Zero and the cryotherapy, because you can help deal with that bacterial side of things as well as moving the fluid around, and helping disperse that inflammation. Then like I'm gonna jump into like the PEMF therapy for I'm at the horse show and the horse has been working hard, and I want to just make sure that I'm taking care of their bodies and that their muscles are feeling loose and happy. I'm probably going to jump to the PEMF. But I think it's one of those things that the more time you spend doing it, the more you understand the results you get for any specific use case and any specific horse, because they all respond a little bit better to one thing or the other, I find.
I think that's a really good point, is all things don't work for all animals.
Yeah.
So one animal might be really receptive to laser and then hate the coldness of cryo. Like I hate cold. The thought of jumping in an ice bath, I haven't done it. I don't want to.
I haven't either. And I tell you, I don't want to either. But that being said, actually, I think part of what makes that so unpleasant is the aspect that you're also getting wet while you're getting cold. And so I find like you couldn't pay me enough money to do a polar plunge, like, jump in the frozen ocean or whatever. But this I find very tolerable. It's weird. It doesn't have that same sort of awful bite to it that like sticking your hand in ice water does. It's interesting.
I'm so glad you clarified that, because just talking about an ice bath like makes my heart race. It just hurts. Like it hurts my nerve endings thinking about it. I'm like, it's just gonna hurt. So do you use that on yourself? Is that legal?
Yeah. And we actually have a whole nother sort of side to America Cryo that deals with human orthopedic and aesthetic use cases of the Sub-Zero. And again, because we're all at the end of the day just land-dwelling mammals, the effects are very similar. And for me, honestly, the biggest thing that I love to run to the Sub-Zero for is I found I can get rid of a headache, like, which is very useful.
Wait, where do you put it for that?
Just like across the top of here.
Really?
And
you do your brain.
That was kind of like
literally have
an
a brain
off-label
freeze.
experiment for me, but it really does, because a lot of the time when you get a headache, and there's obviously like cluster headaches and migraines, and those things are different, but like ye old headache a lot of the time has to do with like tension around either the top of your head or the base of your skull, and you can alleviate that tension, which alleviates a lot of the pain. Now, I'm saying this full disclaimer, like I just experimented on myself a little, but it worked and I liked it.
I do the same. Like whatever I'm gonna put my horses on, I'll try it. And so I am the guinea pig before my horses are, just because I want to know, unless it's absolutely gonna burn the heck out of me.
Well, if you don't know, how can you, to me, like in good conscience, if you don't understand what's going on and how it feels, how can you sort of understand and appreciate how the horses are going to react?
Yeah. I've never taken bute though.
No, I think that one's pretty bad for your kidneys.
Yeah, it's super bad. I actually got a rare anemia just crushing up bute tabs.
Oh, just from the contamination?
Yeah.
Wow.
Yeah. So when people tell me they're like pounding bute, I'm like, oh my gosh, you guys are gonna hurt yourselves so much.
Yeah, not ideal.
Horse people, horse show people, what they do. Do you want to talk about Shockwave a little bit, since it is an offer from your company?
Yeah, sure. So most people, when you hear Shockwave, you think vet. And historically, that's been the case. And typically the reason for that is most of the time when you're talking about Shockwave and you're looking at like a pulse vet or like the big units that the vets bring, that is a focal Shockwave system, where what we offer is a radial Shockwave system. And with lots of hand talking here, a focal Shockwave, if you have the applicator on the skin and there's a point of contact, the way the wave comes out of that probe is at some sort of diameter circle, and it narrows down to a very small point somewhere in the tissue. So the peak energy is delivered somewhere deeper in the tissue, which means that the placement and the angle of that probe are really important, because a small deviation at the surface when you're 6 inches down into the tissue can really send you off axis. And if you deliver that focused peak energy into the wrong place, like into a nerve cluster or something, you can cause harm. And that's why they've typically been reserved for vets, is because in theory, those vets have the understanding of the anatomy to do that properly. With a radial Shockwave, your peak energy is right where you're touching the skin, and then the wave profile from there is basically like a flashlight, like it just broadcasts out and down through the tissue. So the repercussions from the operator point of view is that you know exactly where that peak energy is landing. So as long as you haven't placed the probe somewhere inappropriate, it's not going to be a problem. The downside of that is you lose a little bit of accuracy and you lose a little bit of depth. But in those cases where you're needing that accuracy and that depth, you probably also need the backing and education and training of that anyways. So for typical maintenance type items, at least in my mileage on my horses and the people that I speak to, like, you can get a lot of the same results out of the Shockwave that we offer much more safely and at a much lower cost than having to call the vet out to do it every 2 weeks and spending $600 or $800 every time. Now, that being said, if you have like an acute suspensory lesion or something like that, you might end up calling the vet to make sure that it's put right where you need it in the first session or two, but then you're going to be able to maintain it yourself after that. And at the price point of our Shockwave, which is like $6,500, and the average cost of having the vet out to do it at $600, that's 10 treatments. That's 6 months for some people.
Wow. And so it's a little more superficial. It's broad spec, like covers a broad area. Do you need to give horses like 2 or 3 days off after a Shockwave?
For me, normally, if I'm just doing maintenance type stuff, like the example, I do a lot of their their backs to try and help like those tight, long top line muscles. Normally what I do is the horses have Mondays off. So I do it on Sunday after I ride. They have a light day on Monday where they just go in the paddock or whatever. And then we're kind of back to work on Tuesday. In a more, in a case where you're actually dealing with an injury or something, obviously that protocol is going to be different. But for the average sort of maintenance item, you're going to be sort of one down day after, and then roughly straight back to work for the most part.
And do you have a Shockwave with you?
Yes.
Let's see it. I want to see that. I hope you guys are enjoying this. Let me know if you have any questions. For some reason, I cannot see the Facebook comments tonight. So I apologize if you guys are asking questions. I am not seeing them.
Okay, so
okay,
that is effectively the whole Shockwave unit.
That is not what I expected.
Right?
Yeah, so not at all.
What's interesting is that basically everything is done in the handle. So you have, there's a couple of different, this one's kind of dirty, sorry. You have a couple of different tips that just have a different diameter of the head that contacts the horse. And so that's going to affect a little bit the profile of that wave and the depth. And you use like the really big broad one for like a back. You use this one maybe on a joint. There's a whole training and protocol.
I love that you have options, that it's just not a one thing.
And then, so if you have one of those vet units, the other repercussion that maybe not everybody thinks about unless you've looked at owning one is the they're called trodes in that case, they wear out. So those waves are produced typically acoustically, and they use like internal reflection to create that wave profile, and the tips wear out. So every like 5,000 or 6,000 shocks, you're spending $5,000 on a new applicator tip. Whereas ours is made with a fancy electromagnet that flings that guy back and forth, which taps into the back of the what ultimately is the applicator, which creates a mechanical shock wave by basically doing that on the skin. So there's no strict need on those kind of short timelines to be replacing the tips and the applicators. And if you do have to, like, this is under $50. And really the case that it's gonna need to be replaced is because you dropped it or something. So it's much less running cost too over time than the vet units.
I'm a little clumsy, so for me to buy equipment, I always get super nervous.
You are an extended warranty person.
I am totally that. Yes. So I have purchased like beamers and things in the past and broke them. And it's painful. It's super painful.
Yeah, it hurts when you think about the credit card statement that has to fix that.
Yeah. But the product works great. I just have to be more cautious.
Yeah,
because
totally.
these are legitimate medical equipment. That is totally not what I expected to see.
Yeah,
So thank you for showing me that, because I expected this like
the giant kit and all the stuff. And no, it's much both like safer for most people to use, but also much more user friendly, at least in my opinion.
Yeah, that looks great. And what's the price on that?
Those are $6,500.
Okay, and if you wanted to get like the whole package, do you guys offer a package deal?
Yeah, normally that comes down to like, on the phone call, if people want to do that, then we can kind of work little deals depending on, what kind of mix and matching people are wanting to do. And we normally do run a big big promos for Black Friday where we'll make some sort of call them standard bundles. But yeah, we do our best to let people have these tools at the most affordable price for them that helps the horses and keeps us in business. But that's the goal ultimately, is to help the horses at the end of the day.
Absolutely. And the jumper industry is a very expensive industry.
Yes, you were telling me.
Yeah, it's impressive, the prices of your horses now. Like a house in Alabama, basically.
Yeah. Yeah.
Yeah. So all this equipment is just a drop in the bucket for the maintenance that you guys do.
Well, and especially, the people that do it as a service, there's such a need for that being done that they make it back and dividends. And for somebody like me that has a group of horses that I'm constantly needing to take care of, it pays itself back in saving money on having the vet need to do things, or having an issue that we didn't deal with because it seemed minor and it didn't, you don't want to put $1,500 into it, but it then balloons into something else. Like it really does pay itself back in the better quality of care you can offer without ever needing to think, oh, do I want another vet bill on this, or do I want another chiro bill or whatever. Like you can really help. My light died. you can do better for the horses without having to think about those things on a day-to-day basis. You kind of buy once, cry once a little bit.
So let's recap. Less injections.
Yes.
Hopefully less vet bills.
Yes.
Faster time in rehab.
Yes.
Less scar tissue.
Yes.
Happier horses.
Definitely happier horses.
They perform better.
Yeah, and they're happier doing those jobs because they feel better.
Exactly.
Which ultimately is what benefits us in the end.
Plus you can use it on yourself.
Yes. Yeah, and that's the sneaky like side quest best part is at the end of the day when something hurts because you fell off and you don't want anybody to know about it, you can quickly work on yourself and then you're not limping when you get home.
You're not hammered at the end of the day, and then non-toxic.
Yeah, yeah, 100%. No, that's a huge factor that I think it doesn't get enough consideration.
I agree. I I am always leery of all these new fads and all these topical things that have a mixture of chemistry that nobody's ever done, a 3-year study on of usage.
Yeah, yeah, the efficacy and the repercussions are maybe not the most well researched sometimes.
Yeah. Justin, thank you for your time. Do you have any parting thoughts?
One thing for you guys in your community, and I have to look it up so that I don't make a mistake on it, but we do have a special discount code for you. So holistic 10, and I'm sure that you can post that in your private channel or something. And
Absolutely.
that's good for 10% off any device, and I think that's good through the end of February. So a little
Okay.
special thing for you guys for having me.
And if I have personal clients, my business, so the membership's Holistic Animal Insights, my business is Equine Alternatives, the equine therapeutic business. I have clients from all, like, quite a few states at Thermal. If I send them your way, will you treat them?
I will do my very best to get it done. Yeah.
Like, do you have people that work for you that normally go to the shows and treat other people's horses?
No, so I mostly work on my own horses, and then I'll do demos for people and things. But especially right now, I'm like my primary job is as a rider, and then this is something that I find really interesting and I like doing, and it helps provide for my riding. So I don't make a living off doing treatments. But that being said, if there's a need and I can do it, I'm happy to do it.
Awesome. And so you make more money like just repping the company, selling the machines. That's kind of your main focus.
Yeah, for me, that's more the priority. And honestly, I think that I would go a little stir crazy if I gave up riding time in favor of time doing anything else. So it's better for everybody if I'm on the horses because I'm much more pleasant to be around.
I think that's wisdom.
Yeah, I do my best.
Justin, it's a hard industry to make a living at, and I commend you for knowing your limits.
Well, thank you. I try.
Yeah. Yeah, absolutely. Thank you for your time. Stacy says, wow, another modality to help the horses. And so, yay, team. There's tons of options out there, you guys. We just have to find what's going to work, and there's a lot of good benefits to these machines. And if you can make the price point and the training. How long's the training? It's a week long or a weekend?
Yeah, like you can go through the videos and stuff depending on your sort of uh, how fast you learn, but you can get through all the videos in like an afternoon on a first pass anyways, and then the call with me at the end to sort of finalize the certification stuff takes about an hour. And then that is the end of the training, but really just the start of the learning.
Cool. Excellent. Thank you for your time today. It's such a pleasure, and I hope to meet you, and maybe I'll get you connected with some people.
Yeah, that would be great. I'm happy to answer questions for anybody that has them, especially people part of such a great community. Thanks for having me.
Right on. Take care, you guys. See you next week. Next week, we will be on a Tuesday since Monday's a holiday, and we have the two crazy cat ladies. So thank you, you guys. Bye, Justin. Thank you for
Bye bye.
being with us.